books day. And then they go to school and they're taught some gobbledygook method that's the latest fad in education. They're going to suffer more. I agree with Mehdi, but I think it's the methods of the teacher. You don't have to be some excellent teacher. You have to be just using the right method.
Well, I think people should go on YouTube and learn how to read just from, like, I'm sure there's a phonics on YouTube.
Up to new views and living moments they would never forget.
I've said it once. Video that you just watch right now.
Yeah, if I could add to that.
No, you can't add to that. The reason that this is like, to be clear about what we mean by access to education here, because yeah, you do have access to like educational materials on the internet. You need to know what to look for first off, but then also like, I assume this is about like higher education. You know, that the idea is that we're talking about the kind of education that gets you a career or a job or something. You know, that makes you economically competitive, not just like learning how to read in first grade.
Well, that's not the only thing.
Before first grade, by the way.
But
I agree with you.
A solid correction.
But I also think that you can basically learn most educational stuff online, even the dance stuff. You just can't get the credentials, but you can get. You want to
get that online too now.
They have learning books.
I understand, but you know, you can do it, but you have to know what to look for. And so, you know, there's a lot of slop out there. There's a lot of stuff out there that, like, you might think, oh, I'm going to learn how to do this by looking. You know, there's a lot of scammers out there, too, to teach you how to, like, run a business and make a lot of money, and they're just pyramid scheme scammers.
People say this kind of shit, but I bet none of you would want to drive over a bridge built by autodidacts on the internet.
You can find those up in the hill country if you want.
They had
Right, that's true as well.
I think it's funny that we're all saying, well, you can just learn all this stuff on the internet. Like, none of us learned that way. None of us learned that. None of us are people who, like, had no...
But you didn't know how to work the computer.
Look it up on TikTok. You'll find hobos living in the woods.
Y'all didn't know how to work the computer. Y'all didn't know what to type on the computer, so you couldn't look up the education videos on YouTube. It's an excuse for everything.
It's not.
We got libraries.
You didn't even need cable for media.
What the fuck is going on?
Okay, so like...
None of you learned like this. None of you are people in school and just got on Google and figured it all out.
Well, I've definitely learned. I've definitely learned some things by researching myself. Is it torturing what's meant by access to education? Is it torturing what's meant by access to education? What's meant by that is like economically viable education, right? That gets you a job.
Okay, so there's a part of the conversation. I don't like when people mask their shit talking and their toxicity with like an honest critique of society. Like, if we're looking at American children, no matter their race, on average, American children do not have comprehension skills, period. On average, American children are bad at math. Like, American children's educational outcomes are bad, and it's not even necessarily the children's fault. One part of it is actually, one dude just testified in front of Congress a few months ago. He's an educator, he's a doctor, and he was talking about how technology is actually making our kids dumber. The more you implement technology in schools, the more distractions there are. And it's not even about distractions, it's just about how the human brain has been optimized through like natural selection to learn. We learn from people. We do not learn from gadgets. And this whole entire COVID remote learning thing, we do not learn from technology well. Technology can assist human learning, but when technology is a primary, about 2/3 of all educational outcomes are set on the family life outside of the home. It's not that complicated to do arithmetic. It's not that complicated to learn how to read. But when kids are trying to learn and they're growing up in a toxic family environment, sometimes I feel like teachers are stuck between a rock and a hard place, because the educational outcomes of American children aren't even their fault, even though the teachers aren't perfect. Even if we had perfect teachers, the outcomes would still be bad because our families are fucked up. the kids don't have time to learn because the families are fucked up. They don't have the discipline being enforced upon them. There's so many things that are out of alignment in the society. It's way bigger than black boys don't know how to read, knows how to read. Even when the girls are graduating. Go ahead.
Public school teachers are also living on like subsistence wages. Like they're not paid very well.
No, like this is a civilization. This is bigger than just bringing up a stat about black men to make them look bad. This is an everybody problem. This isn't, except for Asian, Indian, and Nigerian children, this is an everybody problem when it comes to education, just because we don't have the same type of social structures that support children anymore. The technology is making kids dumber. Every single thing in society, since a child is born in 2026, 2025, is trying to.
He is an accelerationist. He claims that young African American man claims he is a stormtrooper and other horrible things. We're gonna move to a different room. Can't stand listening to that bullshit.
She keep calling me right now. I'm on Clubhouse.
Oh, call your girl. Leave me alone.
I'm trying to talk on Clubhouse, man. She can wait. No, I'll call you back. Hold on, bro. Let me pick up this call, bro.
Child. Hey, Igor.
Sam's going now through the drug approval process for a COVID-19 vaccine.
Is this? Are you trying to get your teacher's credentials? Or?
Yeah, I'm going to be starting a credential and master's program in the fall, actually the summer. I haven't decided between there's either the local PSU that I got accepted into, and there's a smaller private school that's actually kind of impressed with that I'm leaning towards. So either way, I will be starting a program, and I've been subbing. Kind of just to, this is late in my career, so I started subbing just to sort of as a proof of concept to see whether I really deal with like around kids. But I kind of like it. They're cool.
What made you decide to go into teaching?
I had always like when I was at university, I'd sort of intended to become a math teacher or some kind of teacher, and then I didn't, partly because my favorite teachers always had cool stories to tell, often about the work they did and stuff at different jobs, and I sort of wanted that, and so I started doing different things, did a bunch of kind of interesting, fun travel things for a while, and then I started working, and then it just, I don't know, several times in the last decades, I can actually look back because I took a test. I started applying for a program, then I got another job. I would often get reinvigorated about doing this in between jobs and stuff, and then I would end up getting another job. Like, okay, well, we'll see. Let's do this for now. And then, anyways, maybe too much time has slipped by, but this is also a good time because both my kids are kind of all finishing up their public education experience. They don't want the schools they're at, so but yeah, this is weirdly good timing. I'm definitely older, but my reception has been very good from students and from other teachers. It's been a very welcoming experience so far, which I was a little surprised by.
You're at a geometry class trying to do something truly worthy. You're coming to an axiom about teaching. Interesting.
Yeah, it's all about proving things.
Yeah.
With what you know. Yeah.
All right, so let me welcome everybody to the room. This is the Scientific Discourse Club.
you're not members of the club, I encourage you to become members.
Because we do have access to like educational materials on the internet. You need to know what to look for first off.
For administrators, okay,
I've said it once, I'll say it again. Do not.
Yeah, very interesting. Okay, so so we have 4 administrators in the club. Myself, I'm a chemist. Ben is a jack of all trades, master of all, mainly electrical engineering, physics, and things like that. John Mallinckrodt, who is a physicist and a retired professor of physics, and Andy, who is an engineer and does engineering stuff. So, master of all. So we do have this time slot. It's 9:30 Pacific, 12:30 Eastern, as a standing time slot on Fridays for our rooms, and we kind of rotate between the 4 of us as whoever wants to do it says, hey, I'm going to take the room this week. But also in the middle of the week, we have just random rooms, pop-up rooms, etc. So follow us, and we'd love to have you in our rooms. Before we start, hi Andy, how are you?
Hey Sam, doing great. Thanks.
Hi Ben, welcome to the stage. Anything
How you doing?
exciting?
Always lots of new and exciting things, but yeah, nothing right now. Right now, I look like a Ghostbuster because I'm about to go and clean my neighbour's digger, and I'm putting on a vacuum cleaner, and it looks so much like a Ghostbusters backpack that it's actually got Ghostbusters stickers on it. So I kept it to crank out the theme tune as well.
Yeah, make sure you don't cross the beams.
Yeah, I'll try not to cross the beams. That is the key.
Yeah. And we also have Yoni on stage, and so Yoni is always a special guest, but especially today because she's the one who suggested we do this room and has been kind of pushing for it for the past several months, and so finally today is the day. Hi Yoni.
Sam, thank you so much for doing this room, and I can't tell you how excited I am. I know that's silly, but it's true.
Well, let's see if we can keep your excitement through the room. So the slides for today are posted. The link to them is posted at the top. Let me know if you guys have any issues accessing them. So this is drug development series. I do several series. I do the pharma series, chemistry series, and IP law series, and that comes from my background of being a PhD chemist and then a patent attorney in the pharmaceutical area. So I basically have dealt with these 3 areas professionally for the past 30 years. So in this pharma series, we're going to talk about the drug development process, meaning that from the time a disease is identified until a drug is approved for that disease. What are the steps that happen? So on the second slide, these are caveats. I'm only going to talk about the approval process for a small organic molecule therapeutic. So this is basically whatever pills and tablets, etc., that you take. Those are all small organic molecule therapeutics, as opposed to biological therapeutics. These are things like Remicade or Humira or other injectable antibodies that are biological therapeutics, or they're gene therapy techniques, or things that are not just a small organic molecule that deals with this. And for small organic molecules, basically anything under 1,000 grams per mole, thereabouts. also are not going to talk about the approval process for vaccines nor for medical devices. These are all, so the four that I have up there are four of the multiple divisions in the FDA, and there are other divisions as well. I'm only going to talk about the small organic molecules.
Let me ask a question.
Uh-huh.
The hot topic on social media right now is peptides. Do peptides fall under either of those two?
Those are biological therapeutics.
Okay, thank you.
Yeah, sure. So on the third slide, I have this cartoon of inside of a cell, and this is called the signal transduction pathway in a cell. So basically, what we have receptors on our cell walls, and these receptors interact with a molecule. That molecule could be a molecule that your body generates, like adrenaline or insulin or any of the other hormones or mediators in the body. And so, or it could be an external one, like a toxin from a bacterium or a biological that you inhale, etc. So this molecule binds to the receptor, and the receptor has two components to it. One is actually three. One is outside of the cell, one is inside of the cell, and one is within the wall of the cell. So when the substrate binds to the receptor, it causes a change in the structure of the protein inside of the cell. And by doing that, that opens up a reactive side of the protein that causes a reaction take place. A goes to B. Then there's another protein that causes the reaction of conversion of B to C, another one C to D, and then D interacts with a nuclear receptor now, and that causes a mechanism inside the nucleus that causes DNA to be transcribed into RNA. RNA comes out of the nucleus, and then the RNA is converted or translated to a protein, and that protein goes ahead and does some functions inside of the cell. Some does a reaction, whatever. This is how a normal body functions, and a normal cell in the body functions. And so what is a disease? And this disease, I'm not talking about infectious diseases or injuries. I'm talking about, other diseases like diabetes or cancer, etc. Disease is a disruption in the signal transduction pathway, meaning that at some point B doesn't go to C. It could be that the process is completely truncated, or it could be that B goes to X, and that causes another signal to be employed, and not the original signal, and so that will cause an irrelevant protein or a bad protein to be synthesized, and that causes malfunction in the cell, and that's a disease. So what is the treatment of a disease? It's the restoration of the proper signal transduction. That's treatment. So what do? We basically introduce chemicals into the cell so that they either stop the bad reaction from happening, push the protein into doing the right reaction, a whole bunch of stuff this drug will do inside of the cell, which causes the restoration of the signal transduction pathway. So so we discovered disease by basically the symptoms of the patient, but then biochemists and physiologists go to work to figure out what is causing this disease, and they will come up with this signal transduction pathway and then malfunction of the signal transduction pathway. So most of this work is done in academia because this work can't directly be commercialized. It's relatively expensive and very risky, as in the sense that you don't know if what you are discovering can lead to a therapeutic or not. And so what we do is that we have kind of put the risk of the non-commercialization of the discovery onto the federal government, on the taxpayers, because this is something that ultimately the taxpayers are going to benefit from it. That's the philosophy. So this slide 3 happens in academia.
Sounds to me like socialism, communism. Government's paying for everything that people need, huh? Even though they didn't know they needed it.
So the first is the basic science that we talked about. That's identifying the target proteins, meaning that the activity of which protein are we going to change, or say modulate the activity of the protein. Which protein? Yes. Go ahead.
Oh, for those who might be listening later that aren't chemists or in this field, I think there's a big misnomer when you said we introduce chemicals to the body and people are like, oh, you shouldn't do that. But for them to understand that the entire body is a complex chemical reaction. So that's not a bad word. And also when you said academia does this, which indicates, I guess, in this case, that doctors aren't involved, that you don't want doctors involved. You wanted academia and the PhDs instead. So I think that's where people might listen to this that don't have that awareness and say, oh, this is the bad people talking. You know what I'm saying?
Yeah, so in the sense of chemicals, water is a chemical, salt is a chemical, right? And so anything that exists as a matter is a chemical. So maybe I should have used the word compound. That would have sounded better, but all compounds are chemicals. So in a scientific sense, the word chemical doesn't carry a bad connotation. It just means a matter that's composed of molecules and atoms. So physicians do not get involved until you have patient contact. And if a physician is involved in anything before that, they're basically using their MD as a PhD. That is, they're not practicing medicine; they're practicing basic science. And so we won't see physicians in drug development until we get to clinical trials. So the first step is basic science, which is, as I said, identify target proteins. We talked about that in slide 3. Second step is what we do in the lab. In the chemistry section of a pharma company. So pharma companies usually have 2 main divisions. One is chemistry, the other one is biology. So it is the chemistry division that starts the work to identify a lead compound and several backup compounds that could be the marketed drug at the end. After that, once the lead and the backup are identified, we go to the biology part of the pharma company, and we conduct these in vitro studies, etc. And once we have all of that data in a satisfactory manner, we now leave the pharma company and go into hospitals. And physicians get involved. The PhDs design the human studies, and the physicians conduct the human studies. And once those human studies are completed satisfactorily, the drug gets marketed, and then there is a post-approval data collection. So the drug company follows how the drug is behaving in the marketplace by collecting data from physicians who prescribe that. So when I started taking Humira, it was shortly after the approval of Humira, and so I was part of that post-approval study, meaning that my GI doctor would send after every visit would send the data to AbbVie, and they would analyze it, and then after a period of time, the study closes and the drug gets the final approval.
And when you're stepping us through all these processes,
My friend,
in general, just
have you ever heard a lawyer and a chemist put on a show about how COVID-19 vaccine was absolutely safe and it's not a bad? Anyways,
So
this is a R-word show, and Zach, I just gotta confirm with you. I am 100% sure that every single person here is R-word, myself included. That everyone, there's not one person here who ain't a fucking clown. This app is a circus.
Wait, not me. That part. Surely not me.
Everyone. It's tragic.
Everyone.
I thought I took the LSAT and I performed very high on the reading comprehension, but horrible on the logic. And it's just ESL town. Imagine like you got some legal problems and you meet this guy that's got like an accent. He's from Turkey or something, and like you're gonna hire him to represent you in court. Like you're a fucking moron. That's just if you can't speak English, in my opinion, what you're always doing
The
is.
other day, sorry.
Go ahead, yeah.
Well, I was just going to tell you, the other day I went to the dentist for a teeth cleaning, and as they were leading me past the cleaning, there's different rooms where you sit in the chair and you get your teeth cleaned.
Mm-hmm.
And I was walking by, and it was like normal, Schwartz from Africa. Normal, African Schwartz. And I was thinking, like, oh my God, I hope I get an American hygienist.
Yeah.
Because I don't want a foreign hygienist. I'm sorry. And then I got an American. I was so happy. And then she gave me a nice teeth cleaning, and it was good.
My hygienist was from Ukraine, and she was asking me, she's like, so what kind of girls are you into? Like, are you single?
Oh my God.
And she's like, I have a friend, I can set you up with her. And I was like, oh, I'll be all right. I appreciate it, And so then I see her on Bumble, and she's like a single mom, and she's like in great shape. And she was such a good hygienist because she was like a power lifter, like that does that CrossFit. And but then maybe because I like rejected her, and like knew her Bumble backstory. Anyways, the next time I go in, I get the dumbest like hygienist I've ever met. So annoying. And she's not even doing the teeth scraping anymore. Now they've moved on to full automation dental cleaning where they spray your mouth with like this chemical, and then they take a like a micro rapid vibrating, cleaner, and then they clean the spray off to confirm they cleaned the area. But it's not like a true, scaling. So
I've seen that. They make your mouth purple and then they take the purple away.
yeah, and they're like, how did you like our new procedure? I'm like, I didn't like it, and I don't want to do this, and I'm never coming back here again because,
Give me the hot Ukrainian.
Yeah, give me the fucking. But see, the thing, I wonder if the Ukrainian requested that she not clean my teeth because she found me so, disagreeable. So I ruined my good dental hygienist relationship by seeing her Bumble and knowing that her friend that she wanted to set me up with was actually her. Anyways.
That's nice to be hit on by a hot Ukrainian dentist.
She was not hot. She was like a 50-year-old woman.
Oh, I see. She was not hot. I missed the part.
No, she wasn't like some 26-year-old recent dental hygienist graduate. She was like a 50-year-old, war-torn single mother.
She was like a marm.
Anyways, welcome to HAP. There are two ways to say the acronym highly annoying people or highly argumentative people, but we have found annoying people are argumentative and very argumentative people are also extremely annoying. Therefore, there's no difference between annoying or argumentative. There is only HAP. If you find yourself being a HAP more than you should be, well, this is your wake-up call to stop being a HAP. If you have a lesbian who gave you $120 or a grandmother that gave you $200, but her fingers are too brittle to whittle those sticks, well, just put a video in front of that fucker and say, watch this video. Can't do it? Too bad. You paid. Sometimes you win, sometimes you lose. Sometimes you're the bug, sometimes you're the windshield. And today I need you to keep working on that basket. Get to work. Anyways, I want to say I was dying laughing the other day. I heard Pepe screaming at a certain particular group of people that claim that they are a certain color. It's kind of ridiculous when a human claims that their whole identity is a color. And so if melatonin density happens to reflect light at a higher, spectral degree, well, that's not who you are, And so we have an education problem, an enlightenment problem, a philosophy problem. We don't have a racial identity problem. That's their politic. And so when Pepe said, zip it, chimp, I couldn't stop laughing. I was like, isn't it funny that you got this little midget of a man screaming at an African American saying zip it, chimp? Because, imagine if you're running a business, and your office turns into a clubhouse room. And, the manager just screams out zip it, chimp. And okay, and they're like, okay, that's racist. I'm going to sue you. So then they get an attorney, take you to court for saying zip it, chimp. In an at-will state, and then they bankrupt you, because you said zip it, chimp. So you just got to be really careful about your thoughts and your words, because every word has a ramification. And I just got to say, a lot of people there's just really high-level R words on Clubhouse that are very high-level R word because they're...
Well, that's what I was going to ask you. Who do you think, because I have an answer, I have a new answer that you're not going to be surprised by, but it might not be the first name you think of. But who do you think is the biggest R word, C word, CHIMP word? Who is the biggest CHIMP on the app?
I really don't know. There's so many. But
it's got to be concrete.
See, honestly,
that guy is so stupid.
He's horrible, but I have heard him say things that had me absolutely dying.
Smart things?
No, not smart, but making fun of and mocking and roasting people things.
He has a sense of humor, is what you're saying? He
can't
be funny.
Dude,
okay.
And I'm telling
he is R word. He is
full. But on a different level, but because he is mean and nasty and crude and brutally honest sometimes, and he has this sense. I heard him say some shit and roast people that had me fucking dying because he was roasting people.
The biggest R word is the person who is R word but also has no humor. And I guess if you have humor, that means you're a little less.
I'm actually in a room right now with what I would call one of the most obnoxious, odious, dangerous, perfidious, stupid people here. R-word people, extreme R-word. He's talking right now in the Pharma Series drug approval process.
Who is it?
His name is Sam. Sam Tamasetti.
What room?
It's called Pharma Series drug approval process. He is he's gay. And yesterday he's like, you got no fucking idea how fucking crazy and evil I can be, bitch. I was like, whoa.
What a psycho.
But anyways, he some people were questioning the COVID-19 Zav, and he flipped out yesterday. So today is his follow-up room where he's now put together a presentation and he's going through the drug approval process, but he's not talking about COVID-19. So it's just very funny to listen to what I would call a high-level homosexual asshole. And if you'd like to just listen in for 1 minute, I give you Sam the asshole.
I can't find the room, so yeah, might as well.
Disease, because if you go higher than the incidence of adverse effects of the drug.
And I just want to say also, if you ever find yourself in a workplace environment or a social environment where somebody sounds like Sam and he's causing conflict, avoid at all costs. These people are trying to get your attention at all times. They like to think of themselves as magnetizers, but they're actually horrific, terrible magnetizers because they're horrible people. And I'm just saying,
lung cancer, we tested on lung cancer cells. If it's diabetes, we tested on insulin receptor cells, on the cells with insulin receptors, etc. And so here we study two things. One is cell bioavailability, meaning that if I put the compound in the medium where that cell is, how much of the compound actually enters the cell. So you may have a compound that has amazing IC50, but when you go to a cellular assay, you see that none of it actually enters the cell. So that's not going to do anything for you. So cell bioavailability is paramount at this stage, and we pick compounds that have the highest cell bioavailability. And also,
that's what you're talking about now. Can you make it so it's local instead of systemic in that?
Yes. So that comes at the stage of compound selection. So basically what you do is that you have proteins or receptors that are similar to each other that you want to distinguish from each other. Let's say you have muscarinic subtype 1 and muscarinic subtype 3, and so you want your drug to be only active against muscarinic receptor subtype 1. And so what you do is that in your high throughput screening assay, you put the different subtypes, and then you pick the one that is specific for the subtype you're interested in. That is a very difficult thing to do, and this is why we're dealing with side effects for every drug, because we can't really.
That's enough.
That selective.
just go in there and ask them. Say, hey Sam, does all this apply to what Pfizer did in developing the COVID-19 vaccine? And did you take the COVID-19 vaccine and multiple boosters? Because I think I'm having long COVID, and you'll just watch him fucking flip the fuck out. Just trust me. Go in there and just say, excuse me, Sam.
Shit got fucked up. Can you repeat the line, please?
Go in there and say, hey, Sam, I've been listening and it's fascinating. I'm just wondering if Pfizer utilized this protocol for COVID-19 vaccine, and if you took the COVID-19 vaccine and how many boosters you took. Because I think, and then go in there and say, and I think on my third booster, that's when I got long COVID. And you'll just watch him fucking, his head will explode like a firework. I wouldn't be surprised if he immediately kicks you, but it will be very funny. Very funny.
Gives us in the cell 50% greater activity, or gets us 50% closer to the goal of treatment, whatever that may be. So here we select compounds that have really high bioavailability and really low EC50s.
Yesterday he said he was an attorney and he was screaming, I'm a lawyer. today he introduces the room. He says, "I'm a chemist." And so yesterday, he went from being a lawyer yesterday to being a chemist today.
Stability and purity. So on the solubility, but then you have lower.
Well, yeah, can I ask a question really quick? Do you think everything that you're saying is very interesting? I'm just wondering, do you think that Pfizer took all this into account when they were creating their vaccine? I'm wondering if did you take any of the booster shots?
Yes.
Because I took 3 boosters, and I think that's probably when I got long COVID. Do you have any opinions about that, like long COVID?
That is a question that's addressed to a physician. I'm not a physician, so I can't answer that. But yes, indeed, Pfizer went through all of these steps. As I said, I'm not, in the first slide, I'm not going to discuss vaccines, but just because the question came up, before the SARS epidemic, most of the work for mRNA vaccines had been done, and so the FDA was aware of all that work. When SARS came, there was a question whether we should introduce mRNA vaccines.